Have you ever wondered what role estrogen plays in women's emotional well-being? Well, it's a fascinating and complex story. Welcome to Channel Health and Alerts. Estrogen, a key hormone in both males and females, plays a significant role in women's emotional health. More women in their estrogen-producing years experience depression and anxiety compared to men or postmenopausal women, which suggests a link between estrogen and mood. However, the way estrogen influences emotion isn't straightforward. It's not simply a matter of having too much or too little estrogen. In fact, the emotional effects of estrogen remain almost as enigmatic as our moods themselves. From puberty, a woman's ovaries begin to release estrogen in sync with each monthly menstrual cycle. This hormone acts throughout the body, including the parts of the brain that control emotion. It increases serotonin and the number of serotonin receptors in the brain, and modifies the production and effects of endorphins, the brain's feel-good chemicals. Despite these seemingly positive effects on the brain, many women's moods actually improve after menopause, when estrogen levels are very low. Some experts suggest that mood disturbances during the reproductive years are due to the hormonal roller coaster. Up to 90% of women experience premenstrual syndrome, or PMS, characterized by physical and emotional symptoms that occur consistently before multiple consecutive menstrual periods. Symptoms disappear after menstruation and cause significant personal problems. A subset of women with more severe symptoms may have premenstrual dysphoric disorder, or PMDD, which some experts consider a severe form of PMS. Postpartum depression, experienced by 10 to 25% of women within the first 6 months after childbirth, is another area where estrogen is implicated. The sudden drop in estrogen after delivery seems like the likely cause, but this link remains unproven. During perimenopause, the months or years before menopause, estrogen levels fluctuate unpredictably. Up to 10% of women experience depression during this time, possibly due to these unstable estrogen levels. After menopause, when estrogen levels fall to very low levels, women's rates of depression decrease, becoming similar to those of men their age. In summary, estrogen plays a complex and crucial role in women's emotional well-being. While we still have much to learn about how this hormone influences mood, it's clear that its impact is significant and far-reaching. Share to care and subscribe.